5 days a week, I work with people in various stages of recovery from addiction. Over and over, I'm confronted with the devastating effects of this disease. Homelessness, joblessness, depression, psychosis, loneliness, parents not able to have contact with their children, intelligent people who can't hold a job, young people with serious medical problems, lost limbs, HIV, hepatitis, people serving time in jail for drug-related crime. As much as I want my patients to do well, as much as I want to relieve their suffering, I can't make anyone stop using, and in fact, that is not my job. My job is to give people the information and objective feedback they need to help them make better choices. Recovery from addiction is a long, arduous process, a constant battle against a culture that glamorizes substance abuse and stigmatizes addicts. 1 in 16 adults in America is living with a substance addiction, if nicotine is included. Nonetheless, 90% of people who try alcohol or marijuana will not get addicted. So why worry? Because 10% will get addiction, and addiction is devastating. Addiction is a chronic illness that ruins the lives of individuals, their friends, and their families. None of the people I treat, not one, planned on getting addicted. We know 10 out of every 100 people will get addicted. What we don't know is which 10. I know you've all heard the statistics and the horror stories. Before you tune out, keep in mind that although it probably won't happen to you, it almost certainly will happen to someone you know, and maybe even to someone you love. I see the consequences of addiction every day. It doesn't always make the headlines, but it is always painful and heartbreaking, and I'm here to tell you that it is avoidable. We can't predict for sure who will become addicted, but we do have some hints for who is at risk. 97% of addicts begin use before age 21. Let me repeat, 97% of addicts begin use before age 21. You can reduce your risk to a nearly negligible 3% just by waiting to begin use. The adolescent brain is still developing. This means youth are more likely to underestimate risk and that substances are more toxic. The amounts of alcohol and marijuana that are considered safe to a fully mature brain are poisonous to a developing brain. Do you remember what I said about waiting until you're 21? I can almost guarantee you that you will not get addicted if you wait until you are 21.